Good morning. I'm Michael Lane. I'm the Police and Crime Commissioner for Hampshire, the Isle of Wight, Portsmouth and Southampton. And I'm about to start a question and answer session with the Chief Constable, Olivia Pinkney, for Hampshire Constabulary. And she and I will be addressing questions from you, the public, and our communities. But I have a couple of quick messages to give you at the get-go. It remains true in these times that we all have a personal responsibility to act well and follow the guidance that we're given to keep us all safer, us individually, our families, and the communities in which we are moving, and increasingly to support those who may well be separated from. Plus, we need to take that personal responsibility beyond just ourselves individually, but also to influence those with whom we have influence. So for some older people, for the younger members of their family, for some younger members of the family, for the older people who are careless of their own safety, not realizing that it impacts on broader safeties in our communities. But if we behave the best we can nudge others to behave well. We can nudge others who know what they should be doing but are tempted to be too close, or to have a barbecue in the back garden, or to behave in a way for purchasing things that create shortages that are unnecessary. If we behave well individually and we influence all those in our network to do the same, things will be easier across the piece. They won't be comfortable, but they'll be easier. And you'll hear several times in the course of this morning, I'm sure, with these question and answers, the answers will contain, this is important because it's about saving lives. These are unprecedented times, of course they are. COVID-19 is the biggest threat we have faced for decades, and it's more than ever vital that we come together to stop this virus before it claims more lives. It is killing people. Daily we hear from the Prime Minister, medical and science experts who set out and explain the new measures being taken to keep us safer. And they set us actions and behaviours we need to adopt to stop COVID-19 spreading, to protect our NHS so that it can save lives. These are the key messages for us all, and they then inform the more detailed actions of the NHS, emergency services, public sector agencies, and all those who are seeking to deliver services for those with need and protect our capacity to help those with the greatest need and deserved priority for care and support. I hear hourly expressions of thanks to those who are supporting us all and delivering in very challenging, stressful circumstances, often at some personal risk. We are blessed by their selfless commitment to service to those in need. Thank you seems too small a phrase, but do please respect and thank those you meet, whether in a medical environment or at the checkout as you get essential supplies. They all deserve our support and patience as they work to deliver services we all want. Before I start the question and answer with the Chief Constable, I want to begin by reminding us all of today's key instructions, which are designed to keep us all, our loved ones and our communities, safer. Starkly, it is stay at home. Staying at home protects the NHS and saves lives. This is the key message. However, there are some options that remain available, but only leaving your home for the following limited purpose and if they're essential for you. To support any medical needs, to provide care, or to help a vulnerable person. Many of us are looking after those who are self-isolated or in protected categories. Learning how to do that well is an essential item for many, and that's clearly why that's allowed. Travelling to and from work, but only where this is absolutely necessary and cannot be done from home. Here in my office, there is only one or two people of the normal range of people providing services to you in the office, and actually often nobody here, because we are all working, setting the example of working from home, keeping our families and ourselves safe whilst continuing to deliver services. So travelling to and from work only when this is absolutely necessary and can't be done from home. And one form of exercise is still in there for people who are alone exercising, keeping their social distancing, or with one member of their family. So it is not about putting yourself in a position where you can spread the virus, but it is about, for the time being, still taking that opportunity to lift your morale by exercise. And it's absolutely clear that we should not cheat on the system of saying no gatherings of 2 or more people. Do not breach that rule. That is how things get spread. The barbecue for the family coming in the back gate, the pressure for young people to want to congregate. It is our responsibility to stay with the social distancing, to stay at home if we at all can, recognizing the stress for some, the pressures for some, the inconvenience for all, but doing the right thing to save lives. And that's my message for this morning. Together, if we all play our part, we can stop spread this disease. Thank you to everyone who's already observed the advice and stayed safe. Please keep doing that. And even in these difficult and challenging times, we can get through this time of national crisis if we all do those things that are asked directly of us. And now to the question and answer session with the Chief Constable, Olivia Pinckney. Chief Constable, thank you for joining me for this session, which is not unnaturally focused on COVID-19. And the issues that the community raises. You and I speak regularly regarding policing's resilience in the face of this pandemic and also its operational response several times yesterday and for extended periods, and that's not unusual. But this session provides our communities the ability to hear us engage over their concerns and questions. Today I want to be the voice of the people of Hampshire, the Isle of Wight, Portsmouth and Southampton, and put their questions directly to you. Over the past week, I've heard from a wide range of people who have concerns about policing and public safety at this time. And these are the questions the public have asked and wish to have your view on the answers, seeking to understand the constabulary's ability to respond. So our first question, and they sometimes are thematic by the number of people who've been asking them. I've received a large number of emails and calls from members of the public concerned about police visibility during this crisis, as they have concerns before the crisis, but particularly now focused on today and for the immediate future. As in any other workforce, coronavirus is impacting on policing resources and your ability to respond, but can you outline how policing is continuing to provide a service to the public and maintain critical services at this time? And can you comment on what the public can expect in terms of visible policing?
Sure, thank you, Commissioner. And as you say in your opening remarks, these are absolutely unprecedented times for us as a country, us as an area, and of course us as a constabulary. But I can reassure on many, many levels. So the first thing to say is that we have a risk register. Pandemic flu has been top of our risks for the last 10 years, not just within the constabulary, but also across all of the partners, statutory and otherwise, that I work with across our area. And indeed, we practice our response to our high risks, and we exercised pandemic flu only in December 2019. So very, very recently, we had over 100 senior leaders from across our geography practicing our response to pandemic flu. So we've got plans and we are putting them in place. And we are working with every other sector throughout the local resilience forum together, and we're working really well. I'm sitting here at our headquarters in Eastleigh, which we share with the fire service. This is the control place for all agencies as we work together across this pandemic, and the military are here amongst us as well. We are all focused on the main objective, which is to prevent the spread of COVID-19, to protect the NHS so that they can save lives. That's what we're all here for, and in the police we are absolutely focused on that too. So that's our primary focus. In policing, we are an essential public service. We are continuing our role for policing. It is different, but I can assure the public that we are here, and we're here absolutely in emergencies. We're here absolutely to deal with the most significant vulnerable and harm that's caused, as we always are. That does not change. I don't anticipate that changing. What the public will see more of are patrols. So we are deliberately out in our communities more to do two things: to reassure, because I know people are scared and I know they're very worried, and I understand that. So we are increasing our patrols in all areas, but linked to that are the new powers that we have, which I can come on to later, which are very much focused on keeping people at home to prevent the spread of the pandemic, to protect the NHS, to save lives. We've also got lots of other people coming to join us, so very grateful to our Special Constabulary, very grateful to their employers who are releasing them to be special constables. So my thanks particularly for local employers who are letting their staff go, continuing to pay them, of course, whilst they can come and work alongside us. But like every other workforce, we are planning on at least 20% of our workforce being away, possibly and probably higher than that. So we do have tried and tested business continuity plans for that, and those are what we are working through. I'm grateful to the public actually as well in lots of regards, but we're finding that in these early stages of real ramping up of our COVID-19 response in the last couple of weeks, 999 calls are staying pretty steady, but I am grateful that the public are responding well, and we are seeing them only calling us when they need us, whether that's on the phones or online, and I'm grateful for that. And I would really want the public to think very carefully about whether they need their police, and to only ask for our help if they really need it. But we're also seeing a huge influx and mobilisation of grassroots community help. We're grateful for that as a constabulary. And Commissioner, I really ask for your help, which I know you are giving, around, helping coordinate that demand, making sure that when people can volunteer, they know where to go, and also really reinforcing those messages about social distancing, because we must all prevent the spread of COVID-19.
So thank you for that introductory answer and the comments on visible policing and the reinforcements that you've just made. There are very particular questions about the enforcement, and Mr. Johnson has written in specifically saying, should we have concerns about the enforcement? What does that mean in practical terms of how that will impact on people out and about? And is this not something that's a step too far? Can you just land for the members of the public the value of the powers as you see it operationally, and why and in what circumstances those might be particularly different or seen differently?
Certainly. So the powers that went through the Lords last night are now enacted and are available to us. If we boil what we're all here for right now, which is to prevent the spread of COVID-19, then there is a role which I think is absolutely right, and I'm very happy and welcome these powers, because there is a role that the police, because we are an essential public service in the public domain, have a particular power right now to really get people to stick with those rules of being at home, social distancing, no big groups. And that's all about preventing the spread of COVID-19. So the way we're going to be doing that, and I've said already, we'll have many, many more patrols out there and people will see that, but we're going to be using those powers as we use all our powers. The British policing model is all about policing by consent, working with communities, and we are not changing from that. So what we are doing is we go out and about with the public, we're going to be talking to people, so we're going to be engaging with people, we're going to explain to those groups that why this matters, and we're going to really encourage them to adhere to it. That is what we want, and the vast majority of people in this country are doing that. And we saw the scenes last weekend in the sunshine, and that's why at the start of this week things changed for all of us as citizens with the Prime Minister's message. So we are going to be encouraging the public to adhere to it, and I'm really confident that nearly everybody will do that because they are good citizens and they know why it matters. If we need to enforce it, of course, we won't hesitate, and we will. And what that means is, fining and that kind of thing for adults who do not conform. We're working through the detail of what it means for young people I haven't got that as we speak first thing this morning because that is all coming out thick and fast from national guidance. But when I do have it, we will adhere to that. But it is all about encouragement. It is the style of policing that people are used to, and therefore the person who raised the question about, is British policing moving to a very different tone that is not how we work around here? Absolutely not. But we do have new powers. I do welcome them. We will use them if we need to.
You and I and lots of others are getting questions, you that aren't about policing specifically, and I about issues that are for other partners to engage in. But they come up under either the new powers or visible policing or what policing engagement might be. A Miss Foreman from the Isle of Wight is concerned, as in other places in the country, about people coming unnecessarily to the island and overloading the services that are there. The MP Bob Seeley has been asking questions in the House about that and is interactive, as you and I often do. I spoke to the leader of the Isle of Wight yesterday to ensure that some of the questions that I receive are passed to the authorities and organisations that can do it. But if Ms Foreman is raising the question, are there any specific operational concerns and processes about that policing can either help with or is concerned by, do you have anything to say to her?
Yes, so in the same way that you spoke with the leader of the council on the island and Bob Seeley, the MP, yesterday, similarly I spoke with John Metcalfe, who's the chief exec of the Isle of Wight Council. So from a policing perspective, the rules are the same as they are on the mainland as well. So that is all about those groups that encouraging to go home. It's very clear that the rules do not allow for travel to a second home, but I know that those issues are really front and centre within the minds of John Metcalfe, the chief exec, and his team, together with others on the island, and they are working out with lots of other ways that they can discourage people from coming to second homes and effectively overwhelming or helping, or rather making worse, the stretch on the health service on the island. So that is something really for them. From a policing perspective, we are sticking with, as I've said earlier, all of our patrols, our encouragement to disperse, our encouragement to go home, and enforcement where we need to.
And my encouragement to everybody is that if your journey isn't necessary, don't do it. If it's essential for some reason, then be really clear what that answer is. We all need to stay at home if we can during these circumstances, and that's the core national message. I want to ask, we have quite a few examples where shelves in shops and supermarkets are stripped unnecessarily by people inappropriately purchasing, but most recently there are increasing reservations and concerns about the courtesy and respect and issues of managing people in close confines in supermarkets and other places. How is policing working with supermarkets and retailers at this time to support their actions, or are you needing with your team to intervene in any way?
So at a national level, policing is working very closely with all the big four supermarkets who are working together very, very well. And you'll have heard through other mechanisms around, the confidence around the food supply chain and so on. And that's really encouraging for all of us, I know. The national lead on that happens to be a Hampshire officer. And he is daily speaking with those big four supermarkets to check in with them. Locally, we're doing the same thing. And I know the vast majority of shoppers are behaving considerately and adhering to the store's own rules about timings of turning up and when their slots are for vulnerable and when their slots are for emergency workers and so on. And most people are sticking with that really, really well. Where there are emergencies, where there are assaults, and sadly we have seen that, within the supermarket and the shopping areas, we're dealing with those and responding as everyone would hope and expect we do. What we are not doing, and it is not a role for policing at this time, is monitoring, standing outside supermarkets, ensuring that people are social distancing and so on. That is not a role at this time for policing. It is a role for the supermarkets themselves, and I know they are taking that very seriously and increasing their own security to make sure that happens.
And it's really helpful to hear those kind of answers in your voice, because Not unnaturally, the reputation of our constabulary is such that they can solve anything at any time, in any circumstance, but actually very many of the issues we face today are about personal responsibility and other agencies too playing their better part to do that, so that policing has capacity for its tasks, and we all protect the NHS and that element, as we're both saying regularly.
Absolutely.
One of the key items in my email bag at the moment is a sense from those in our rural communities that they feel forgotten. There are lots of things about towns and villages and cities, and they wonder about their particular circumstances for safety and protection being respected. And I wonder, because we have a Country Watch team that I really value, and I know the communities value, and you do too, can you give reassurance that the specific issues for safety and security and policing in the rural community is still on the agenda, on your mind?
Absolutely, it's on the agenda, and if people have seen them around and about, they are, and if people follow them on social media, they'll absolutely see that the Country Watch team, who are fantastic, are out and about. It is a harsh reality that we must anticipate they will fall ill and self-isolate in the same rates as everyone else. So there is an inevitability about that, although we're doing everything we can, of course, to help them keep themselves healthy. But it is still important, and I said earlier, we are actually increasing patrols as well, and people will see more people about. I am very confident that if we can make sure that what we can do with on the phone, what we can do with online, we absolutely will. That will free up officers to respond where we need to calls across our geography, whether in the cities or in the countryside. We will absolutely do that. But we're also being careful that we're not spreaders as well. So one of the things I've asked, I've got fantastic confidence in the commanders who are working through the detail of this, that we are not going to increase vulnerability within homes if we don't need to. So we will work in a very different way. So yes, we'll protect what we can. Patrolling is going up, but sadly, we must anticipate that at times some of those individuals will not be at work for all the same reasons that everyone else is suffering.
At this time, one of the encouraging things is so many very local voluntary groups setting up the ability to deliver groceries or medicines to isolated people, and offering other services. So the befriending arrangements for someone who can't get out to have a phone call. Those all seem to me the best of our communities, but sometimes people worry about the circumstances of people preying on those who are isolated now more. Are there guidance things that you, as the Chief Constable, would say to people to be able to differentiate an offer of support that is a risk compared to the welcome offer of local community support that many people are offering at the moment?
Absolutely. So over the next couple of days, people have been hugely generous signing up for the NHS volunteering and also signing up locally through district councils and city councils to volunteer, which is great. And they are leading that army coordinating that army of volunteers. But I would really urge people, if they're not expecting someone on their doorstep, if they're not expecting deliveries, they're not expecting to be offered help, be very, very, very suspicious of it. Sadly, there are too many people who will take opportunities to take advantage of this national crisis, and every single person who is a legitimate volunteer will have identification on them. They would expect that identification to be checked. They would expect to have a front door closed while someone checked it out online or however else, and they will be super patient about that. If someone is pushy or impatient, chances are it's not legitimate. We must all look out for that. And I would really encourage people who are putting in the calls to their elderly neighbours, ringing elderly family particularly, remind them. One of the difficulties with loneliness, and we know through this time people are lonely and they're scared, is if there's a friendly face and a friendly voice who's talking and getting rid of some of that loneliness for a period, then sadly human nature is they will warm towards it, and we need to be really careful that people aren't sucked in. People who want to trick them are very good. They're good tricksters. They're good at what they do. So be really vigilant. And if it isn't properly checked, it doesn't look right, you're not expecting it, don't accept it.
And is it right to say be very careful if someone contacts you and you already have trusted them for some time, you will be able to make your own judgment. If they're new to you and you haven't met them and they're not introduced properly, please check them out before you receive anything. Is that?
Absolutely.
Okay. That's about being careful when we're offered real support. Sadly, there have been one or two occasions when it appears that hate crime is dialed up. There's a public attack at inappropriate behaviours towards some of our Chinese communities. And is that on the radar at the moment? And is that something that policing can step on very firmly because it is inappropriate and criminal behaviour often?
Oh, no, absolutely. And we've seen some vile things, haven't we? And some of them have been very heavily reported, particularly on some of our Chinese community. And it's horrific what they have suffered. Some people have suffered, and we have been alongside them, and we have been patrolling, and we are working with so many people to put support around those people, stop it happening again. More broadly, we're not seeing an increase in numbers of hate crime, so that is reassuring, but of course each and every one is one too many. I realise that, but we do want to know about it. So we're not seeing at the moment a real increase in COVID related hate crime, but if anyone is suffering anything, tell us, tell the police, or if you want to report through True Vision, do that, or indeed, Commissioner, on your PCC website as well. There are lots of ways that people can report hate crime. We do want to know about it. We have great partnerships. We can help you. So if you're suffering it, please tell us.
Right. And there are some risks that are particularly rising at the moment, with people needing to be at home for extended periods or under the separation processes that COVID-19 is creating. I'm thinking particularly of the issues of identifying domestic abuse or child abuse, of the scams that are particularly preying on people to sell gels or to provide services that are fake and false. Can you offer some guidance on how you're interacting with those and what people can do to keep themselves safer?
Sure. So if I start with the scams particularly, and that's both kind of online scams as well as doorstep scams. So we are seeing a huge increase in online scams, and that is following the wave elsewhere in the world, where we know sadly other countries are ahead of us in terms of their COVID exposure. So they have seen 100% increase in scamming, and we fully anticipate to follow sadly in that trend. There are people who at scale will look to exploit people who are at home, who are scared, and who are in need of new services, and also who are in need of reliable information often as much as anything else. So we know that this is going to be a huge coalescence of determined cyber attacks, and we must all do everything we possibly can. So the kind of opportunities that are new that cyber criminals will be looking to use will be around medical supplies, around hospitals, doctor surgeries, pretending to be them, and pretending to be sending out information or making phone calls on their behalf. And we've already said about, if you're not expecting that contact, be really, really suspicious of it. What we're doing from a law enforcement perspective, if I start with the national, there's lots of stuff that the National Crime Agency and the Cybersecurity Centre are sending out. It's really good information. Look at it online. If you're looking after an elderly person who hasn't got online information, get it printed out, stick it in an envelope, get it to them, because it's really good information that they need to be aware of. Within our own region, we have our regional organised crime unit, which serves all of us across the South East and is part of our policing response. They are building a whole COVID, cyber and fraud protect campaign, exactly as we have Christmas campaigns and student campaigns. They are doing for us a COVID Protect campaign, which you will start to see very, very soon, and you can trust those sources. Within the constabulary, in addition to those things, we've also got our own Cyber Protect officers. They have fantastic social media sites. The Hants Cyber Protect Twitter pages are really accurate. They're real go-to locations for information, so please do use them and just be vigilant, as I've said. On the doorstep side of things, I've already touched on that a little bit, but just make sure if it's someone you don't know, someone new, however plausible they seem in how they're talking and their confidence of what they're talking about, be suspicious, check their identification, and make sure that you're reminding elderly members of your family and elderly people that you're keeping an eye out for, that they're looking out for that.
Oh, good. And the children are off from school. Many of them are doing virtual learning and also lots of play. They're likely to become frustrated and stressed by not being able to group together in the energetic way that children can. Are there things particularly to look out for in protecting our very young?
There are, and if I start with the kind of wider point and then perhaps move on to domestic abuse and child sexual exploitation, which you asked me in the last question, and forgive me, I didn't fully answer. So you're right, there are so many people. Schools are being fantastic at doing stuff remotely. So much of the education sector and charitable sector are being really creative, really innovative about having activity and engagement for young people, and it's there, so use it. There's some brilliant resources out there. We all know, don't we, about keeping our young people safe online, and that can be a particular tension when a parent or carer is working from home in that same environment. It can be really tempting, can't it, just to, the kids are online, great, they're quiet, at least I can get on and work. So just make sure that the checks are in place, make sure you've got your parental controls in place, make sure you're talking to your young people about what they're doing online. I absolutely understand that tension, but it is just really important to take out a slice of the day to do that. And there are some fantastic resources about staying safe online, which the Cyber Security Centre have, also the NPCC. There are others, really good resources about staying safe online. So do go to those tried and tested sources for that. One of the worries I have, and I was on a call with you, Commissioner, last night with a large number of our local MPs, is about antisocial behaviour as these days and weeks go on, particularly as the sun remains out, which is, of course, lovely, is what happens with groups of young people. I've talked earlier about the powers I've got, the new powers that I've got within policing, and of course we will use them, but they don't really deal in the long term with that. So it's a big worry for me. I know the MPs are worried about it. I know the chief execs of local authorities are worrying about it. And together we are starting to work through, okay, in this social distancing world, in a world where we're going to have to deliver services in a very different way, what are we going to do to prepare for the weeks and months ahead for that problem? So I don't have the answer to that now. I am really worried about it. We will work up some plans together. More broadly, with for young people at home, sadly, whether it's domestic abuse or child abuse, Commissioner, we know that sometimes being at home is the least safe place for someone to be. We know that people suffer domestic abuse in huge numbers. We know, sadly, children are abused in huge numbers. And my genuine concern, and we're starting to see this nationally, is that the crimes that happen behind closed doors will increase. And we must all be vigilant around that. So I'm really clear that from a policing perspective, domestic abuse, child abuse, they are always a top priority. They will stay so. So we are not dropping off our response to that one bit. And we're absolutely committed to maintaining that, and I'm confident that we can. But it does mean that a lot of the services, many of which, Commissioner, you commission and put in place, have to be dealt with differently when the people who normally give those face-to-face support services can't do it. And I know they're being hugely creative around how they can continue to deliver that support for victims of child abuse, domestic abuse in a different way, and they're working as fast as they possibly can to change that. Similarly, Public Health England, this has been on their radar from the start. So this is something that everyone is worrying about, and I'm seeing huge activity to really shift and pivot the way we deliver service for people at risk in a very different way, and that is happening and changing day by day by day. I think the point for the general public is, whilst people are looking out for one another for things like food, for things like medicine, I think we should also be vigilant for one another around this kind of behaviour and this kind of abuse and risk. And it's just, it's not about spying on one another, but it is about just being a friendly ear and making sure that people know if they're worrying or they're suffering something, that even though they're indoors, there's still support available, and I really want people to use it and ask for it. But I do worry about it, and we've seen around the globe, similarly as we've seen with increase in digital and cyber fraud, we have seen around the globe with COVID an increase in domestic abuse, increase in child abuse. I am really worried about it.
I think the public will be reassured that it's you are thinking about it, and not all the answers are known, but it is high on your agenda. I know from all our conversations that the greatest threats and risks of harm are always on your mind, as the capacity to include as much as you can in that ability to intervene with those. But when you were talking about antisocial behaviour, and I was asking about it because that's one of the most frequent 3 letters ASB that are said to both of us, probably. For me, there's a question about, are there things that can escalate, not just antisocial behaviour, but some behaviours that can escalate, that if they can be stopped early, prevent worse happening, more risk happening, including that grouping together of people. Do you have the capacity to still hear and identify and react if you see an area that's beginning to look warm or hot for extra, very local activity to try and nip it in the bud, or some other phrase?
We do. So we have really, you'd expect us to have really mature, nuanced monitoring of the demand that comes into us, and we do that 3 times a day. We always do that. That's normal for us, and we continue to do that in this time. By encouraging as much work to be done online, on the phone, and thereby I can use my remote working, self-isolating staff to do that. It frees up as many officers that I can for patrolling and for that wider work. So we do have the mature way of handling that, and we have already lots of ways with partners that we work to try and stop things escalating. Policing is not the answer to everything, though. We really need people to be kind to one another, to be patient with one another, to have a bit of give and take in this global crisis. And it's not something that any arm of the state is going to be able to come in and resolve, and they are going to have to be kind. There is something about being kinder and more patient in this period.
Yeah, the responsibility of our communities to look after themselves and to look after those people that they already know well, and to influence them to best behaviour, is something that we're all keen should happen. Carelessly letting resource be drawn away from the central protections and support that is specialist, it is just likely to have an escalating impact on the ability to deliver, I think. So I think that's the encouragement, isn't it?
Absolutely, Commissioner. And the other thing is, we must not, by policing having to be hands-on with someone, we're risk spreading it. So we absolutely will do that if we have to, but we are conscious of not spreading COVID-19. So we really want people to not put us in a position where we need to do that.
We should not respect anyone that forces you or colleagues into doing that. It's dialing up the risk for everybody, and that's a very significant addition to just the ill behaviour of people. It's the real risk to life. So I hope the system will recognise that, if necessary, to proportionately. You and I both wear a number of hats. I sometimes almost visualise you changing the hats. The Local Resilience Forum, which you're a key part of, and the Criminal Justice System Board, that is our local board. Are there key things that in your policing hat, but sitting on those boards, that key messages for the public about things that they could help with, or responses they may not be able to expect just temporarily for the time being?
Yeah, so thank you. So from a criminal justice perspective, if you look at the whole system from police, Crown Prosecution Service, courts, prisons, probation, this is a very, very complex sector, and in the national media there's been a number of announcements about changes and potential changes within that as we go through this COVID period. There is national coordination of that, and within policing, my colleague Nick Efgrave, Assistant Commissioner in the Met, he leads that for us all, and I was on the phone with him only this morning. More locally, Assistant Chief Constable Stuart Murray is leading with all of our local partners to do our coordination across our area. Rest assured, and I really want people to hear this, where justice needs to be served, when there's serious crime and they've been and court cases need to happen in the Crown Court, they still will. But it's going to be later. But that's a matter that Her Majesty's Courts and Tribunal Service are working through, and they're working through with the judiciary through the Ministry of Justice. So that side of it, they are working through the detailed planning, but I am assured that those trials that need to go to court will go to court. In the here and now, the magistracy are being hugely flexible, and the urgent work is happening. So that's things like remand hearings and so on. Those are all happening. So the urgent stuff that needs to be dealt with on the day is being dealt with through the magistrate system, and I'm confident of that. From a policing perspective, if we need to arrest someone, we will. But going back to how I said about not wanting to be spreaders, we are, doing that when it's necessary. But we always have had other ways that we can secure justice for people, and we use those as we always have done. So yes, if people need to be arrested, they will be. But of course, we are trying to use that sparingly, as I'm sure people would understand. But our priority is to prevent the spread of the virus, of course. But our core one is to keep the public safe, and therefore, if we need to take someone out of circulation by arresting them, we absolutely will, and my officers have got the equipment and the personal protection equipment to do that. So there's a lot of detail being worked up around the whole criminal justice space. People will be hearing that at a national level. That's being echoed here at the local level, and we are working as fast and as effectively as we can in what is a very complex criminal justice setup, because some of it's local, some of it's national, some of it's regional, but we are absolutely foot to the floor on that as well.
In the introduction to this session, I was encouraging our colleagues to understand the pressure on all of those who are providing public-facing services, and to be very clear about they deserve to be thanked. In my own police and crime plan, the caring for and keeping safer individuals, their families and our communities is at the heart of what you have been talking about, and I believe will be reassuring to the public about things that are in hand and that you will be continuing to do. I often make the point that one very key community is that of policing and the broader policing family. And at times my colleagues who have responsibilities for other emergency services in other areas will have their version of this question, but my question to you is, are we managing to do everything that's necessary to support our police at this time, to support them directly and their families as they take risk on our behalf, as they always do, but in this occasion with some dialed up risk of infection or other issues that COVID-19 gives? Are we looking after them well enough, and are they feeling supported?
We are doing everything we can, and I'm getting a lot of messages every day from staff saying, we know this is really hard, thank you. So the most obvious one that one hears about a lot is the personal protective equipment, PPE, that my staff have got. It's not of the standard that the NHS has, but I think to a large extent that's okay. We do have some stores of that if we really need it, and we are getting more supplies of personal protective equipment coming to us, which I'm really glad about, and nationally in policing we are sure of our supply as well. So they've got the equipment that they need. I'm encouraging them, and they are social distancing as they do their work. So things like we are single crewing cars and sending 2 cars where we would used to send a double crew car, very practical things like that to help themselves keep themselves safe. I've amended my ask of them so that we are not both either spreaders, as I've said, but also putting them in harm's way when they don't need to be, because actually the greater public good is that we don't contract COVID ourselves and then unwittingly spread it to others. So we're doing that as well. But all of my staff, officers, staff and volunteers, they're all partners, parents, sons, daughters. They have got all the worries that anyone else does. Very grateful to the education sector, so that all of my people are key workers and the education is there for their kids if they need it. And that's been a huge weight off people's minds. We have got people who are over 70, we're working with them. We've also got lots of people who in their household are some of those that need to be shielded, the 1.5 million. So we're working in a bespoke way with them. I'm really clear with my workforce that we are in this for the long run. I expect this to take 6 months. I expect then to have to recover for 6 months after that. This is a massive deal. I've been in policing nearly 29 years, and those 29 years have set me up to do with what is the hardest thing we have ever done in UK policing. But I'm really confident in the people I lead, really confident in the people who are doing the planning. We're hugely confident in how we're implementing those plans. And part of that is that my workforce and the volunteers who I include in that description are able to work hard when they're here, and they're able to rest, recover and come back to work, because I need them here for the long run. This is a marathon, not a sprint, and I'm being very explicit with them about my expectations. So I'm making sure they get time off, I'm making sure they take their holiday, I'm making sure in whatever way I can, I'm helping them keep their families safe so they're able to be at work as much as they possibly can.
So thank you for that very firm description. These conversations called Compass, but today specifically about COVID-19, are opportunities for me to ask you directly questions the public want me to challenge you about and to press you about, and we've met some of those questions today. I also have a responsibility to have the voice of the public I serve, and in that voice, representing all the people of Portsmouth, Southampton, the Isle of Wight and Hampshire, I want to say on their behalf to you, and please pass to the workforce, thank you for what you're doing. Hampshire Constabulary has a deservedly high reputation, and we know that the vast majority of our community really value what you do, support you in what you're doing, and wish you all to stay as safe as you can. So the last point I want to make very firmly on behalf of our communities is a thank you to you and to your workforce. Please pass that on. And thank you very much for the questions and answers today. I'm sure we'll be doing this again in the not too dim and distant future. Thank you, Olivia.